So today, guys, we're starting the new chapter and the second last chapter of the book. It's chapter 10, looking at Australia's health system. Now, this chapter is probably really relevant to you guys for next year for Unit 3, mainly because in Unit 3, Outcome 2, you actually go through a lot of what we cover in this chapter again. So you again go through Medicare, you again look at private health insurance, you again look at the pharmaceutical benefit scheme. All of these things are covered again in Unit 3 Outcome 2. So that's why it's pretty important for you guys to have a really good understanding of these topics so that next year it's a little bit easier for you. You don't have to kind of start from scratch. Okay, so if you've got any questions about any of the topics we're going to go through in this chapter, just let me know. I'm happy to explain it again. So today we're only going to start with the first spread of this chapter, which is 10.2, which covers two really important topics of Medicare, which you might have heard of before, and the pharmaceutical benefit scheme, which you may not have heard of before. Okay, so these are basically the two topics we're going to be covering for today. Now, what is Medicare? Even if you haven't heard of the word Medicare before, you've probably seen the Medicare card. Okay, you've probably seen it when you were young, when you went with your mum or dad to the doctors, and they kind of would take it out and give it to the receptionist to kind of look at and put into the computer or whatever. This is a Medicare card. Okay, anyone above the age of 15 in Australia can have a Medicare card. Okay, a Medicare card is basically a card that says that you, first of all, you're an Australian citizen or permanent resident. Okay, because only these groups of people can actually get a Medicare card. For example, when my grandpa came to Australia a few years ago, he couldn't have a Medicare card because he wasn't a citizen. He wasn't a permanent resident. Okay, if you've got relatives coming from overseas, usually we have to take out separate healthcare plans for them because they are not counted on Medicare. So Medicare is kind of like an Australian exclusive. It's like if you're an Australian citizen, so you're like born here, or you become an Australian citizen, or you are a permanent resident because you came here to study or work or whatever, you are eligible to apply for a Medicare card and get a Medicare card. Like any other form of important identification, Medicare is like basically another form of identification. Not photo ID, but it still can be used as an identification there. So anyway, that's what Medicare is. First of all, we need to know Medicare is only accessible by Australian citizens and permanent residents. And there are a few other countries involved in that. I'll talk about that in a bit. Secondly, we have to remember that Medicare is not free healthcare. Okay, I don't know why a lot of people seem to be under the impression that, oh, we've got the Medicare card, we just show it whenever we go to the doctor, we don't have to pay extra money. Yeah, you don't have to pay extra money out of your pocket at the doctors, but actually, in order for you to continue experiencing the benefits of Medicare, Medicare is actually funded through taxpayer money, which means when your parents work in the future, inshallah, when you work, the government is going to take money out of your yearly salary or annual salary there to fund Medicare. Okay, for most people, this will be about 2% of your yearly salary there, which actually calculates to be a lot. And it depends on the income. If you're really earning a lot of money and, you know, really earning a lot there, you're a high income earner, you might get more taken out of your income. We'll talk about the percentages and stuff in the next few slides. Okay, so guys, when you write your answer either this year or next year and you're explaining what Medicare is, never say that Medicare is free. It's not free healthcare. It's healthcare that's provided at a subsidized rate, which means that obviously compared to the folks in America, we have a good healthcare system. We don't have to pay, let's say, $6,000 in order for a woman to give birth in a hospital. But Medicare is not free. Okay, Medicare is subsidized because the government takes money out of our tax. It's offered to us at a lower cost. That's what subsidized means, when you offer something at a lower cost. But it's not free. It's not like it's completely free where we're not paying anything at all. That money is getting deducted from our tax. So rather than saying free, you can say that Medicare is provided to people with little to no out-of-pocket costs. So either we're not paying anything out of pocket extra, okay, on top of what we were taxed, or we're paying very little, okay? And I'll talk about what we mean by paying very little when we talk about these services now. All right, so what does this green Medicare card actually get you? What are the benefits? What are you eligible for? The services that are covered by Medicare include doctor visits or GP visits, only to bulk billed doctor clinics or medical clinics, okay? When you're driving past medical clinics, you might have seen the sign for bulk billing. Okay, you might have seen a sign on the front of the medical clinic that said bulk billing, or that we do bulk billing, whatever. Okay, bulk billing means that those medical centers only need you to show your Medicare card and don't ask you for extra money on top of that. However, and this is the majority, okay, the majority of our medical centers in most of our areas here in the suburbs are bulk billed. So we generally don't have to take out our wallet and pay extra money at the reception after we've finished seeing the doctor. However, there are some that are not bulk billed. Okay, these are the more private medical clinics. Okay, these are the ones where you show your Medicare card and then you also have to pay, let's say, an extra $27 on top of that. So you have to take out your wallet, pay the $27 after you've seen the doctor. Okay, for most of us, this is kind of not a familiar concept because we're so used to the idea of bulk billing, but we have to remember that GPs that don't bulk bill or that make you pay extra out of your pocket afterwards also exist. Okay, these are the ones that don't do bulk billing. So just remember the difference between bulk billing, doctors who only need to see your card, who don't want the extra cash, and doctors who are in private medical clinics that are non-bulk billed. Okay. Hospitalizations and specialist appointments in public hospitals. So let's say you've got a heart issue. Let's say you are obese and you've got to see a dietitian. Let's say you've got, some other developmental issue. Okay. If you're going to go to a hospital, a public hospital, so let's say Sunshine Hospital. Okay, Sunshine Hospital is one example of a public hospital. And it's a hospital where if you've got these conditions, you can go, you can show your Medicare card and you can get these appointments for basically little to no out-of-pocket cost. You're not paying anything extra. You're not paying extra $27 or $47 at the reception. You're just showing your Medicare card and you're getting that service, okay? Private hospitals are different, guys. Private hospitals are a little bit different. For example, St. Vincent's private, that's a private hospital and that is going to charge you extra money, okay? Unless you've got private health insurance, which is the next topic that we'll look at in the next spread, but Medicare only covers public health services, so public hospitals and public health services then. Okay, pathology tests. So pathology tests are everything to do with like blood test, anything like a diagnostic test. So x-rays are covered, eye tests at participating optometrists. So if you go to like Specsavers or OPSM, usually their eye tests are fully covered by Medicare. Okay, you just show your Medicare card and you get the eye test done. Some optometrists, probably the more fancier private ones, they do charge extra. So they might say, okay, show me your Medicare card, all good. Okay, the total for your eye test was $23. So you have to take out your wallet and pay an extra $23 on top of the Medicare. Okay, so on top of showing your Medicare card. Obviously in Specsavers, if you've ever had an eye test in recent times, unless you're buying glasses, that's a different story. But if you've just gone and had the eye test and got your prescription done, they don't charge you extra money. They don't ask you or give you a bill or a payment for that. Okay, they're happy with just your Medicare card. So that's only for participating optometrists, Specsavers being the main example there. Okay, now, so that's what's covered by Medicare. And remember, you don't have to learn everything, but maybe just learn at least, let's say at least 2 services, okay, that are covered by Medicare. Let's talk about now the services that are not covered. Dental treatments. If you've ever had to go to the dentist to get a filling done, usually your parents will be paying out of pocket there, okay? However, there is a Medicare plan. So a lot of you, and I think until the age of 15 or 16, I can't even remember, it might even be 17 or 18, but there is something called the Medicare dental plan where I think Medicare or the Australian government, because they realized a lot of young children in Australia drink too much soft drink and they tend to have a lot of dental issues, the government actually has like a $1,000 a year allocation to everyone that's like in school age or high school to basically get dental treatment done. I think it's still around if I'm not mistaken. That's separate though. We're talking about normal dental treatments. Look, the minute you finish school, you're no longer going to be eligible for any child dental plans and that kind of stuff. So at that point, you will be going to the dentist and getting your fillings done. And you can't just flash your Medicare card. You have to give your proper payment there, okay? Dental treatments are not covered by Medicare, but if you have like a private health insurance cover, which is a separate thing you have to take out, it can be covered using the private health insurance cover. Ambulance services are not covered by Medicare, but a lot of people think they are, okay? Generally, if you don't have ambulance membership and if you don't have private health insurance and you need an ambulance, you might have to shell thousands of dollars out of your pocket, because ambulance services are a pretty big resource and they do cost a lot of money, especially in emergency situations, to get all those resources to the correct place. So ambulance services are not covered by Medicare either. Allied health services like acupuncture, for example, or naturopathy, all those things are also not covered by Medicare. So if you go to an acupuncture, I think it's called an acupuncturist, or a person who does acupuncture, you will have to pay out of pocket there as well. Medicare doesn't cover that. And corrective aid. So if you've ever gone to Specsavers and you've got your prescription and then you say, okay, mom, I want to buy some glasses. When you get those glasses or you get those contact lenses or whatever it is you get, you have to pay for those out of your pocket. That's not covered by the Medicare card alone. Okay, and like I said before, hospitalizations at a private hospital, Medicare only ever covers the public health side of things. So private hospitals, private medical clinics are not covered. So again, hospitalizations at a private hospital are not covered. Now, in your answers, guys, be very careful. If you just write services not covered by Medicare, hospitalizations, full stop, and you don't specify whether it's at a private or public hospital, I can't give you the mark for that. That's going to be automatically incorrect. You always need to specify, are we talking about private hospital or public hospital? Okay, so that's the idea. So here, guys, learn any two as well. Okay, so any two that are not covered and any two services that are covered. Okay, so that's the introduction into Medicare. Just really need to understand what it is and what services are covered there. Now we're looking at the advantages and the disadvantages of Medicare. And this kind of comes under the idea or under the question command term of how we evaluate Medicare. Okay, if we ever ask you in the SAC or you see a question in the book saying, evaluate the evaluate the health system in terms of Medicare, okay? Or in terms of how Medicare functions, you need to be able to say some advantages. So basically some good things about Medicare and then some disadvantages or some drawbacks or limitations of Medicare. I'll just go through them, but you don't have to learn all of them. I'll just say learn any two advantages and any two disadvantages, okay? The first advantage is obviously we're getting essential medical services done. I wouldn't call it free, so I'll probably just cross that out. Reduced cost for essential medical services, okay, including low cost or little to no cost treatment and accommodation in a public hospital. Look, if you're strapped for cash, you don't have a lot of money on you, you're not going to be picky and be like, oh, actually, I want to be put in a private hospital. You're not going to be that picky, okay? You are going to be happy to have the services that you are, particularly when we look across the globe to countries like America, whose health system, people are like dying because they can't even, afford to go to the hospital to get like, a surgery for their knee. Women are giving birth at home in their bathrooms because they just can't afford the costs of being able to, go to the hospital and pay maybe $6-7 grand to give birth to a child. It's not sustainable. It's not financially viable for those people to do that. So compared to those people, we have a much, much reduced cost in terms of healthcare. And for that reason, we are able to get essential treatment that we need when we need it, which reduces the risk of us getting sick in the long run. Again, explaining why we have such a good health status, whereas America doesn't really, okay? Health system plays a big role there. One of the other advantages is that you do have a choice of doctor for out-of-hospital services, but not always, okay? So for example, if you're giving birth and you want a female doctor to look into that, it's kind of hard for you to really request that if you're in a public hospital, okay? Whereas if you're in a private hospital, then it's a little bit more easier to do that. So it really depends. It's available to all Australian citizens and permanent residents. So again, it's kind of one of the benefits of being an Australian, I guess, something that we can be proud of there, something that is given to us, okay? There's a reciprocal agreement. This is what I was saying before in the previous slide, that with Medicare, with that green Medicare card, if I'm an Australian and I've got the green Medicare card and I'm going to a country like Sweden or Japan or New Zealand, my Medicare card actually can allow me to access some of the medical treatments in those countries, because we as the Australian government, we have a reciprocal agreement with those countries. Basically, it's like New Zealand and Australia's government sits down together and we're like, okay, if my people come to your country, can they access medical treatment with the healthcare related card that we have? And then they're like, yeah, and it's the same, okay? And it goes both ways. So if I go to New Zealand, I can access some of the healthcare in their country. Like if I need to go to the doctors for a quick visit or something while I'm in New Zealand, I can do that, okay? Because of the reciprocal agreement. Also, another advantage is that it covers the basic tests and examinations, okay, without having to, you know, waste a lot of extra money on medical treatments. We can actually cover the basics, okay. And for most people who don't have major illnesses or major chronic diseases, and that kind of stuff, the basics is all we need. We don't need extra special fancy treatment there. We just need to be able to see a doctor when we need one. We need to be able to just, you know, maybe go get an x-ray done every now and then if we get into an accident or whatever, and get an eye test done once a year or something. So it's not a big deal, and Medicare does cover those basics there. The Medicare safety net is not so important for you guys. I'm not going to go through this too much. It's just basically something that exists for people who actually do have stuff like chronic disease, or who do have autoimmune conditions where they need to go to the doctor very frequently, and they need to use Medicare more than the normal person. And how just because they've got to use Medicare more, it doesn't mean that their payments are going to be increased, or it doesn't mean that the government's going to tax them more than they tax other people. Okay, that's just the safety net. So some disadvantages for in-hospital treatments, as I mentioned before, like, for example, birth, childbirth, pregnancy-related stuff, surgeries, all that kind of stuff. If you're in hospital and it's a treatment, you don't have a choice of doctor, because think about it, hospitals are already overcrowded as they are. They're already under a lot of stress. So you can't really be like, oh yeah, I want to choose my doctor, particularly if you're in a public hospital. Private hospitals have a bit more flexibility. There's a lot of waiting lists. You might have heard of people who need to get a wisdom tooth out and they've gone through the public health system, or, you know, the public dental hospitals there, and they've had to wait maybe 3 years to get a surgery to get heart surgery or something. People might have to wait 2 years. Okay, there's a big waiting list for many treatments, and some people might be suffering more and increasing their morbidity as they wait to get that treatment done. Obviously, Medicare doesn't cover alternative therapy. So if you're one of those people that are like, oh, I believe in, you know, naturopathy, I don't believe in Western medicine. Well, naturopathy, non-Western medicine, or Asian traditional Chinese medicine, all these things are not covered in Medicare. Okay, these are things you have to get separately and you have to pay for separately. And if you're going to a non-bulk bill doctor, often Medicare will not cover the full amount. So remember the example I gave before, if you go to the doctor that's a non-bulk billed or a private doctor, and then you go to the reception and you show your Medicare card, they might be like, okay, that's fine, but now you've got to pay an extra $27 on top. So often if you're going to a non-bulk billed doctor or a private doctor there, you will have to pay out of your pocket as well. So Medicare doesn't cover the whole amount. So that's just the advantages and disadvantages, basically almost the same stuff you're going to learn next year in terms of advantages and disadvantages there. Okay, so now we're looking at how Medicare is funded, or why is Medicare not considered free healthcare? This is the reason, okay? Medicare is funded by the federal government. Now, in order for the government to run Medicare, they need money. The government is not just taking money out of thin air. They're not just taking money out of their own pockets. Okay, so basically, when we're talking about how Medicare is funded, we have to remember that there are different amounts that are charged in terms of tax, depending on how much you pay. The general rule here, guys, is the more money you earn, the more tax you pay. Okay, this is the sad reality. The money that you earn, or the money that comes on your pay slip as a yearly salary, that's not how much you get in pocket. Okay, obviously after taxes, it might be 20, 30, even 40,000 less than that amount. Okay, depending on how much you earn, of course. Now, the first way that the federal government fund Medicare is through the 2% Medicare levy. Okay, this is the base charge. We call it the base charge because everybody, regardless of whether you're a high income earner or average, will be charged the base charge, okay, the 2%. Now, this is the primary means or the main way which the government funds Medicare. Now, on top of this, if you're a high income earner, the government's got their eye on you. They're like, ooh, this person be earning a lot of money. They want to charge you more. So they're like, okay, high income earner, you're earning like, let's say 150K, 180K. I want you to pay the 2%, but I also want you to pay an additional 1%. Okay, so in total, 2% plus 1%, 3% of your total income, if you earn 150K, is going to Medicare. Okay, and that's a pretty big amount if you think about it. Okay, so if I was to do the calculations here, let's see how much that would be. That would be almost That's a pretty big amount. So basically almost, almost $10,000 they're going to your Medicare levy there. Okay. And we have to remember that there's also general income tax. So that's just Medicare, but there's other income tax we have to pay. Okay. Income tax that goes towards building roads, income tax that goes towards schools. Okay. Being an adult is not fun. Okay. Earning money is not easy. So 2 and 1%. Okay. If you're even higher than that, let's say you're earning about 250K. The government's like, oh, you're earning even more. So let me charge you the 2% plus the extra 1.5%. Okay. So that's basically going to be 3.5% in total out of your total $250,000, which actually ends up coming to a lot after you look at the normal income tax as well. Okay, so Medicare is just one part of that equation there. There's other income taxes that also go towards deducting your income or your salary. Okay, so the amount of Medicare levy that you need to pay depends on your income. Obviously, the less income you earn, the less general tax you have to pay. Okay, and the less general tax you have to pay, the less Medicare levy you pay as well overall. Okay, that's the general rule. Okay, we're not going to take someone who's only earning like $60,000 and make them pay a lot of money towards Medicare, because it's not sustainable according to the government. It's not fair either to charge someone who's only earning a low income to begin with. So when we're talking about high income earners, there's some exemptions though. Okay, so high income earners might be like, oh my God, I'm earning 250K. Why do I have to give 3% to Medicare? I don't want to do this. I don't want to give the additional. I'm happy to pay the basic 2%, but I don't want to give extra on top of that. There are some things that these high income earners can do that will excuse them or exempt them from paying that additional surcharge. Okay, because remember, the Medicare levy is the base charge. This one everyone has to pay. The surcharge is the additional amount. Okay, this is the additional amount that only the high income earners have to pay there. All right, so that's the basic idea there. So just remember, guys, depending on your income, you will get charged accordingly for Medicare. So just remember these numbers here. I'll show you a proper chart from the website, the government website, that makes this a bit clearer. Where is it? Okay, first we'll go through this. So the Medicare levy surcharge, aka the second point here, the additional 1 or 1.5% that high income earners have to pay, is only charged to people who earn higher incomes above a specific threshold. Okay, to encourage those people to take out private health insurance to ease the load on public health care. So that's the basic idea there. Okay, so when we're talking about Medicare levy surcharge, we have to remember it's only high income earners, and I'll give you the definition of high income earners in the next slide. But in the brackets here, I've written down that it's an individual earning over 90,000. So if you earn over 90,000 as a single person, that's a high income for you as a single person. If we're talking about a couple, like a husband and wife or husband, wife with a kid, for example, and if that total combined income is over 180,000, that's a pretty high income for a family. Okay, and we know that there are a lot of individuals and a lot of families who actually earn these amounts, and they would be paying the Medicare levy surcharge. So they pay the base charge, which is 2%, and on top of that, they're paying an additional 1% or 1.5% there. Okay. For very high income earners, so these are the people that are literally probably rolling in cash. We're talking about individuals or single people who earn over $140,000. That's a lot. And who don't have private health insurance. Okay, so that's a pretty big amount for an individual person. And so from the government's perspective, they're like, you're just a single person on your own. You don't really have a family and you're earning $140,000. Let me just steal an extra 1 to 1.5% of your income on top of the 2%, because you, unlike other people, can afford to shell out that money. You can afford to help us to fund Medicare. Okay, that's the basic thoughts that are going through the government's head when they do this or when they deduct the money. Okay, so let's go to the next slide. Now, I just want to show you guys the actual figures. Now, we're not going to ask you to memorize these figures, but it helps to understand what we mean by the Medicare levy surcharge. Okay, so we can see here, for example, with the Medicare levy surcharge, if you earn $90,000 or less, or you're a family and you earn $180,000 or less, that's not really, that's not going to really incur you a Medicare levy surcharge. So you pay the basic 2%, the base surcharge, but you don't have to pay extra on top of that. Okay, 2% base only. So no extra, that's why it's 0. Tier 1 though, literally the minute you earn $1 over $90,000, you fall into the next bracket, which is the tier 1. From this point, if you're a single person, you've got to pay an extra 1%. So you pay the 2% base, the 2% Medicare levy, the base levy. And then on top of that, you also pay the extra 1%, and that's the Medicare levy surcharge, the additional charge. Okay, same thing for the next one and for the next one. You can see the highest that the government can charge you extra on top of the 2% Medicare levy base is 1.5%. They can't charge you like an extra 3% or 4% there. That's not fair and that's not right. So if you earn over $140,000 as a single person or $280,000 or more as a family, the government will charge you the 2% base. So the 2% base Medicare levy, which is what everyone pays. On top of that, they will also charge you a 1.5% Medicare levy surcharge. Okay, so that's the basic idea. Like I said, you don't need to memorize the numbers, but it does help to understand what are we talking, what numbers are we talking when we say high income earners or very high income earners. Okay, so that's the basic idea there. Okay, so this is just a summary. We've already gone through this, so I'm not going to go through it again. Just a quick table that shows you what Medicare covers and what it doesn't cover. And the last thing we're going through for today, guys, is we're going through this other part of the healthcare system, which is kind of connected to Medicare as well. It's called PBS. PBS is a little bit different from Medicare because it basically is to do with medicines. Okay, pharmaceutical. When we think of pharmaceuticals, we think of medicines, right? You go to the pharmacy to buy medicines. So pharmaceutical benefit scheme is all to do with your meds or your medicine or your medications. Okay, specifically with the pharmaceutical benefit scheme, we're talking about prescription medicine. We're talking about antibiotics, for example. Okay, so that's the basic idea there. So the pharmaceutical benefit scheme, similar to Medicare, was introduced and established by the federal government or the national government of Australia to subsidize. Again, we see the word subsidize. Subsidize means offer at a low cost, not free, but offer at a lower cost than usual or compared to normal. Okay, to lower the cost or to subsidize the cost of a wide range of prescription medicines. And this is the key idea. So Australians can purchase vital medications at affordable prices so that no one's socioeconomic status is affecting their ability to purchase medication that helps them to stay alive or that helps them to stay well. We remember when we did socioeconomic status in Unit 1, we learned about this idea, and socioeconomic status is a big topic next year too, but we learned about this idea of people who are low SES can't afford proper nutritious food, and if they need medication, they can't often buy that medication. Okay, we know GP visits are covered by Medicare, but actual cost of medications are not. So I go to my GP, I tell him, oh, doc, I've got a fever. What can you do for me? He prescribes me amoxicillin, which is one of the most common antibiotics that many of us may have already, used at some point in our lives. Okay, he prescribes me amoxicillin. And once I leave the doctor's clinic, I've got to go buy that. That's not going to come to me for free. The doctor doesn't just give that to me. So when I have to go to Chemist Warehouse or go to the pharmacy to buy amoxicillin, I do have to shell money out of my pocket. It could be $10, it could be $15, whatever it is, but I've got to give some money for that in order to buy that. Okay. So although PBS is linked to Medicare, pharmaceutical medicines or prescription drugs are not really covered by Medicare. That's one thing you need to remember. Okay, not all medications are also covered by the PBS. For example, some medications that have more that are more to do with like cosmetic purposes, or like, for example, related to the skin or related to those kinds of purposes that are not actually for treating a disease or treating a condition, that's not actually covered by PBS. Okay, so that's important to remember that only some medications are covered under the pharmaceutical benefit scheme, those vital medications. Obviously, amoxicillin is covered on the scheme, but other prescription drugs are not, okay? Particularly if those prescription drugs have cosmetic purposes rather than medicinal purposes there. Okay, when you get your prescription next time at the doctor, you might notice two boxes, okay? There's a box that says PBS there, I don't know if you can see it, and then one that says RPBS. If your doctor ticks the PBS box here, what that means is when you go and give this to the chemist sees the tick there and will give you this medicine at a cheaper cost. What that means is that if this medicine normally costs, let's say $15 for people who don't have PBS, For people who are eligible for PBS, so we're talking about low income holders like concession card holders, healthcare card holders. We're talking about people who were war veterans, okay? These people or these three groups can actually get this medication, not at $15, but maybe at $5 or maybe $6. And you can see how much money they are saving as a result of that little PBS box, having a tick next to it, okay? So unlike Medicare, we talked about a similarity between Medicare and PBS, but we also need to talk about a difference, that even though Medicare is accessible to all people, that all people can go to the doctor, show the Medicare green color card and get a doctor's appointment, PBS is not accessible to all people. So if you don't have a concession card or a healthcare card, you can't access Medicare. Okay, for example, I don't have a concession card or healthcare card. So if I was to go to the doctors and get a medicine, and obviously for me, the doctor will not tick PBS. Okay, the reason being that I'm not eligible. Okay, I don't qualify for PBS. So there will literally be no tick here for me. It will just be completely blank. And so when the chemist or the pharmacist gets my prescription script, they know that they don't need to undercharge me. They don't need to give me a cheaper price because I'm not eligible for that. I'm not one of the special groups or one of the eligible groups there. Okay, that's pharmaceutical benefit scheme. Again, talking about providing Australians with vital medications at affordable prices. So just because they can't afford medications, it doesn't mean they have to go without. It doesn't mean that their health has to suffer as a result of that. Okay. Also, oh, sorry, one more thing I forgot to mention. If you've got a disease like cancer, or you've got like a really major chronic disease where your medication is not $15, $20, but we're talking about your medication being like $300. Okay, and there are people who pay $300 for medications. Okay, what PBS then does is it doesn't reduce or doesn't cover the whole cost, because that is a big cost there. But what it does is PBS says, okay, the PBS will cover like $190. Okay, that's covered by PBS. And so what happens is that the patient has to just pay the remaining gap amount. Gap is literally the amount that you need to pay out of your pocket after the government has funded or covered some part of that cost for you. So if the government funds or covers the cost of $190 from the $300 medication for PBS, that means you only really need to pay $110 out of your pocket as the gap payment. Okay, and the rest is covered by the government, or it's covered by the PBS there, which is the scheme that allows for cheaper medications or subsidized medications to be purchased. So these people who are suffering with the chronic disease, who are already in a compromised state of well-being and health, they can still afford to purchase that medication there at a much lower cost. So they're not even paying half of the cost of the normal medication that they would have had to pay, because PBS has covered most of it for them. Okay, that's the basic idea. Cool. So that's basically Medicare and PBS covered. So I'll just stop the recording here.